Hi Professor Jack, it's Robin Hare, and this is going to be the final presentation for this class of Healthcare Management Information System, and mine is going to be on case 14.11, putting in an EHR implementation for the Leonard Williams Medical Center. The Leonard Williams Medical Center is a 240-bed community hospital that operates in upstate New York, and they are currently looking into implementing a computerized physician order entry system after a thorough analysis of what the hospital needs were. The issue that they are currently facing is that after they authorized this, the physicians that are associated with the hospital became a little bit anxious that things weren't moving fast enough, and they obtained approval on their own to get an EHR for $300,000. The problem that they're currently facing is that the physicians have ignored the hospital's CIO technical and integration advice and requirements during their EHR's research. And what that means is that the hospital is concerned that they're not going to get a CPO system that is going to be in coordination with what the hospital requires, and it's not going to coordinate together. So implementation of the CPOE, and the reason why I picked this is because medication errors are compound as a medical crisis of its own, sometimes with a tragic result. On average, a U.S. hospital patient is subjected to at least one medication error per day. And medication error contributes to more than 7,000 inpatient deaths per year across America. Sadly, this is an ever-present threat to the patient safety, in which can originate to prescribing it, which means the doctors could possibly have had an error with the way that they wrote it on the prescription pad, on an order sheet, or anything like that. And what happens is the transcriber could have read it wrong, the pharmacy could have read it wrong, or anything like that, and therefore the medication is wrote incorrectly. And then when it's written up on the MAR, or the medication paper, it is dispensed incorrectly as well. So therefore, when it goes to get to the administration stage, the nurse is giving what is written down, and the medication is given incorrectly. In this presentation, you're going to see how implementation of a computerized physician's ordering entry system will be beneficial to the Leonard Williams Medical Center to help save those issues on medication errors. So identifying the needs of the Leonard Williams Hospital, it basically comes down to quality improvement. What is the quality improvement of the hospital is that we're going to get better care for the patients by assuring that they're getting the correct medications, their orders are the correct, they're getting the correct testings, the correct lab work for what is going on with them, because the doctors are going to be able to put that into the information system of the CPOE by having those orders available to them either at the doctor's office, their home, or there at the hospital, and put those orders in directly. The patients are going to be safer by having that CPOE with that high-tech information, and the HIPAA is going to be, their privacy is going to be a little bit better. They're not going to have to worry about faxes going to the wrong places because of a paper order being faxed. It was supposed to be going down to pharmacy, but instead it got faxed up to the wrong floor, or to another hospital, or to another physician's office. All of this is in coordination, and you get good quality improvement with patient safety. The risk analysis strategy that they used at the Leonard Williams Hospital was they did a thorough analysis of the organization's strategies and needs. They looked at efforts from other hospitals and what they were utilizing. They discussed different analogies from the vendors and what was offered by them. And they also talked to the primary doctors that would be working with the system. The system development life cycle is about planning. Who is going to be building it, and why are we building this system? Obviously, we're building it to make sure that the hospital is going to be safe, the patients are going to be safe, and that we're going to have a good quality outcome of that. We're going to analyze it. Again, the who, the what, the where of the system. Who's going to use it, what's it going to be used for, and where is it going to be used. The who is the doctor, the what is the CPOE, and where is at the hospital, or the doctor's office, or at their home. Design is how will the system work. The system's going to work by allowing the doctors to put in correct orders right there in real life time, instead of it being a paper order, a telephone order, or a written order. The implementation will hopefully come within a couple of months so that the system is delivered and put into action within a very short amount of time once the steering committee has put that in. The impact of technology versus the culture of the Leonard Williams Center. So they have different areas of cultures coming in and out of that because they are in upper state New York, which is actually in the lower corner of New York, outside of New York City. So they do have some of the deaf and hard of hearing that come in, and they are offered a sign language interpreter who is there Monday through Friday from 7 a.m. to 9 a.m. They are available via page, so all the hospital staff has to do is page the sign language interpreter, and they are able to come to the room and do sign language for the hospital staff. The other thing that they have is they do have people there that are in foreign language, and there is a 24-hour interpreter service via the Language Line Solutions. Many hospitals across the United States are using Language Line Solutions, which you can talk to somebody over the telephone, or you can also talk to them via the internet, which is going to be a virtual session. Most hospitals have laptops or iPads that are able to connect into the languagelinesolutions.com, and you can actually talk to somebody via the iPad in real time, and they're able to give you a in-person conversation over the phone with them. Next, we're going to look over the roles and responsibilities of the key players. The steering committee is the ones that are going to be the key players of the quality improvement of this. They're making sure that the development tracks, they're going to track the metrics of what's going on with the CPOE. They're monitoring and supporting the project. They're making sure that everything is going to be in coordination with the physicians. They're going to make sure that there is going to be improvement for satisfaction of the customers. The other thing that we're going to look at here is the assessing the enterprise-wide data role of health information governments. So the health information management professionals have the skills, experience, and expertise to lead the transition from traditional health information management to enterprise-wide information governments. That improves quality of care and organizational performance. They are well aware of the laws, regulations that govern health information, and they understand that the value of accurate, complete, and timely information to overall organization performance. So here we're going to compare and contrast the roles of technology and enterprise-wide information as relates to data governance. As you can see here is a lot of IT information. IT is responsible for making sure that viruses are kept from getting in, and they are going to make sure that there are bugs and stuff are kept out on both sides of data and information. They're going to make sure that everything is in compliance and that the information that is needed is going to be large enough to make sure it can hold the patient's information, their payments, their medications, their allergies, their medical history, and other things that is going to be good so that the patient safety is number one. So here it's going to be summarize the best practice and policies as they relate to data governance, information exchange, technical and structural interoperability. So here basically any kind of information or various components of a system that improves the function of a business process by integrating different resources. So basically this here is that the policy and procedures of any type of interaction is going to make sure that the data is good enough and the volume is going to be good enough to support any type of large complex information such as the hospital. So here it's going to say explain the economic impact that the system is going to have on the hospital. So of course everyone agrees that by going with electronic health records it makes a clinical sense to go with that. So some of the things that economically is going to improve the system itself is that since the adoption of CPOE across the United States in 2008, an estimated 12.5% reduction in medication errors has occurred, or a 17.4 million medication error averted in 1 year. So again, 12.5 reduction in medication errors and 17.4 million averted errors occurred in 1 year. That's crazy to me. So once again, the decrease not only chances patient safety, but also financially implicates as well. Medication errors cause longer hospital stays and an estimated $4 million per hospital in addition annually per patient. So what that means is that the hospital has to pay $4 million per hospital stay each year per person. So one person each day has a chance of having a medication error. So think about that financially. That hospital is at risk for millions and millions and millions of dollars if they have one medication error. With $240 beds, they have a chance of 240 medication errors in one day. So of course the cash-in incentives, as a financial incentive to practice with the EHR, Medicare and Medicaid patients, the federal government offered a generous 5-year payout range of $44,000 to $63,750 per physician and provider. The problem with that is that they had to make sure that they not only purchased it, but they were using the system. What that means is that for over 5 years, each year the physicians were getting paid an extra $44,000 to $63,000 for using an EHR system. The problem is they had to actually be using it. And I don't think many people had problems with that. So lastly, here on the last slide, we're going to talk about the 3 questions that I came up with to go to the board about implementing the CPOE and the problems that they're facing with the doctors. The first one is, how do we get the providers back on track with the hospital? I felt that having the executives meet with the physicians instead of just a steering committee may make them see that the hospital is willing to meet and consider their ideas as well. The other one is, should the board require both systems utilized in the hospital come from the same vendor? I believe that that is true. Yes, the CPOE should come from the same vendor or at least a sister company so the transition of data can be implemented easier. We want this to go as smoothly as possible and we want the system to work as quickly as possible. The next question is, if the physicians continue to embark on the journey on their own and purchase their own CPOE, is the hospital going to allow them to utilize it at the hospital? The answer I came up with is if the physicians continue on their own and purchase their own EHR without consulting the hospital to assure that it's compatible, there should be a consequence that they may not use the system at the hospital and that the hospital will not advance theirs or purchase another system to make it accommodate the hospital or the doctor's system. I feel that this was only fair because I feel like the doctors are rushing this instead of taking their time to coordinate with the hospital and not making sure that everything is in safe practice and it's best for the patients instead of best for the doctors. So this is my presentation, and I hope that this is everything that you wanted, Professor Jack. I hope that you have a great class, and thank you very much for everything, and I wish you good luck in all your other classes, and I hope to see you again soon.